Greetings, everybody. I'm Dr. Shruti Desai, one of the Rheumatology Fellows. On the context of World Obesity Day on 4th of March, today we are going to discuss about the complex interplay between obesity and the psychological well-being. We all know that obesity is one of the major health ailment, especially in this generation, be it either due to the sedentary lifestyle or easy accessibility for food. A lot has been said about the reasons for obesity and what can be done, but less is talked about its psychological impact. So to discuss about this important topic, we have Dr. Chandrasekhar, who is a consultant rheumatologist, and Dr. Rajeshwari, our clinical psychologist. So Dr. Rajeshwari, we'll begin with you. We would like to know, does psychological well-being or the mental health problem, does that cause obesity?
So if you ask me, does mental health issues cause obesity? The answer is partial yes and partial no. But yes, obesity can cause mental health issues. So in this modern world, we can see a lot of people, there are a lot of influences going around. So we have certain body type which has been accepted in the society. So especially for the younger generation. So each one of them have their own idol, hero or the heroine, they have to be like that. So even in the outside world also, the acceptance of the people is also something like that. So if you have to fit into that company, or if you have to fit into that film industry or something like that, they expect you to be in a certain way. So there is a trend going on. This is the perfect body shape, or the body size has to be there, which is not appropriate. So this is the stress which has this will cause stress in the younger generation. It might cause stress or anxiety or eating related disease, eating related disorders like binge eating. So because of that, the obesity may cause mental health illness.
Dr. Chandrasekhar, we would like you to talk about how does the obesity impact on the psychological well-being of the person?
Yeah, I think as Rajeshwari was explaining, so certainly obesity makes sometimes people to feel a little lonely, depressed, or there is a lot of issues which they feel impacted, especially on the, we call them as body image being distorted by themselves, which can really disturb them. But of course, one can overcome these kind of issues by a positive thought process and making themselves what am I is what I am. So those kind of concepts which is built in, then they should be able to overcome that. But still, certainly in a world when you see 40% of them or 70, 80% of them are sleek, slim, flexible, moving with, and the definition of what is good and what is not good are being different. So there is obviously you are really disturbed about being obese. And so that's how you may end up in having a sort of a feeling of not good, not right. It really impacts the responses and the way we work with it. And in addition to that, sometimes if you go to the store or if you go to any other place, you don't get your clothing, your size and shapes. That also puts you down. Thinking that I have to literally run around to get what I want. And some of the pattern, fashion, some of the fits, which if you also would love to wear, is not available or not accessible. This all puts in the thought process of any individual. There is something wrong. So that feeling that something wrong is something which really can depress or really can put anybody's psychological balance out of the thought process. Of course, there are ways to get out of that, but best before is to get the obesity out if at all is possible. The reason is the obesity is not just the psychological impact, it also have an impact on overall body's health. So that being the case, psychological aspect is one, and also it's best, if possible, to get the obesity out.
Dr. Rajeshwari, we all know that again, when a person is trying to lose weight or trying to get rid of the obesity, there are a lot of challenges they have to face, and it is not as easy as it is said. So what are the common barriers or the psychological common barriers in the treatment of obesity?
So one thing we should always know is obesity is not only because of eating. So there are a lot of reasons for obesity. It might be genetic, it might be because of inappropriate diet, it might be because of some of the chronic illness or the medications you take. So the reasons are different. First, we should always find what is the exact reason which is leading to obese. One more thing, see, gaining weight takes time. It is not like within 3 months you have gained 10 kgs or within 6 months you have gained 10 kgs. It is a slow process. Maybe within a span of 2 years, you might have gained 10 kgs. So while losing weight also, while shedding down that weight also, it takes time. So we see a lot of celebrities losing weight within 3 months, 6 months, toned body. So in layman perspective, we should always understand that they have their own medical team, or they have their own trainers or the dietitians, nutritionists. So they work together. So it is inappropriate or it is wrong that we should always think that we can lose weight in that short period of time. Some people may go for take some supplements like fat burners. So again, which will, along with your mental health, it will also lead to physical destruction also. So losing weight treatment is one, we do regular exercises. It might be 45 minutes of walking, or 20 minutes of yoga. So we always tell, do yoga, do some meditation, or go for a jogging, normal walk. So, and consistency is also needed. You do for 1 month and you don't get the result and you'll stop. So usually in this generation, what people expect is an instant. It should be like a magic. 1 month you will do and you will lose everything. So it is not possible. So you should accept the reality that it takes time and you will be consistent in that. Have a good eating pattern, be healthy. Eat whatever you make sure you are eating home cooked food, whatever is prepared at home, some vegetables or the fruits or the home cooked food. So that proportion is also needed. So losing weight depends both on physical activity and the diet. So either of them is disturbed, you may not get the desired result in the given point of time.
Dr. Chandrasekhar, how can one cope with the challenges they face during their journey of weight loss, and what facilities or what help is available for them?
One of the challenges that all of us face is, sometimes it becomes easy for, as a physician or a clinician or an advisor of a dietitian, to say that avoid eating, reduce the eating, control your eating, go for physical exercise and activities. It's all said, it's easy to say, but when it comes to the matter of implementation, as Rajeshwari was saying, following it up on a regular basis is important. See, when we say following it on a regular basis, it has a lot of issues related to that. For example, some individuals may have a compulsion to eat. Some individuals may have a sort of a difficulty to hold themselves when they see some food to eat. So there are a lot of issues which sometimes psychological perspective, which often ignored or neglected by us. Because we always say that if you ask any patient, any individual, they say, oh no, if you ask me, I don't eat at all, sir. In a day, I will eat 2 times or 3 times. But forgetting that in between eats are there. In between eats are something which is half of the time by temptations, half of the time because of the lack of control on the mind, not to eat or not to work with it, is something which is required. Which is something which is often forgotten, both by the patient as well as by the physician who advise about it. The losing weight is, or shaping up ourselves, is something which needs a continuous perseverance or continuous follow-up of every act that is required when we do it. Of course, quite a good number of people are busy. We have our own commitments and our own issues. And getting priorities of life also becomes a confusion. Half of the time, it is the psychological distress or a misunderstanding of the aspects of life are responsible for misplacement of priorities. So I sometimes say that misplacement of priorities is a sort of maladaptation of an individual. A maladaptation of an individual could be a minor psychological illness. It's minor because it doesn't impact it. It actually sometimes impacts positively when it comes to society. Say, for example, as a doc, everyone looks for me to work 24 hours. But that's not possible because the priority is society would be happy if I work like that. But if I work like that, I will be in trouble. So these are the issues that are always there. So the issue that remains for us is we half of the time ignore that there is something more than just the diet, just the exercise, and also a need to look into their psychological and other perspectives. So putting all this together, we are planning to have a sort of an obesity guidance clinic for the individuals who would like to lose the weight. So we wanted the approach in a multi-dimensional way. So physician tries to evaluate to figure out, is there some other metabolic cause or a drug cause or a genetic, any other issues which may not allow the person to lose the weight. If that's the case, then we need to intervene from that angle. In addition, a dietary counseling to understand what are the best diet, what are the low calorie diet, what the diet which you will have without losing the essential nutrients, because for us, there are essential nutrients which are required for the day-to-day affair of the functioning of the body, like vitamins, minerals, etc. We should not have it less and when the calories are reduced. So a plan to all this, plus from the psychological perspective, how to cope with these issues. So we have a team which we have tried to organize, which can help in the long run to work to get yourself shaped up from the what we otherwise call obesity to a healthy body weight. I mean, these are what we are planning to offer in our centers as what we call as obesity clinic or weight reduction clinic. I think these facilities are to be kickstarted in a couple of weeks, or maybe as early as possible. And these are the things which will help in going forward.
Dr. Rajeshwari, how can a family help or support in the treatment of obesity?
Yeah, family plays a major role. So if there is any psychological illness due to obesity, family always should support them instead of demotivating them, saying that, you know, you can't lose weight, or this is not, I mean, you have exercised for 2 months and you have not even lost a single kg or 2 kgs of weight, and demotivating them. It is always, you know, better to be there and tell, yes, you can do that. So you can also join them in their activities or in the exercises they do, so that they are getting your company also, so that they don't feel lonely in that. And one more thing, as parents, what they can do is they can usually we see parents feeding their children always from outside. So maybe they might be busy in some other work, they need someone who can, you know, instantly feed their children. So they always order from outside, or, you know, KFCs, fries, McD's. So they always prefer such kind of food nowadays. So in initial stage only, if you avoid all those things, so they won't put on weight in the adulthood. So the future problems or the future issues can be resolved there. So initially, from the childhood only, if you have a good eating habit, or the, you know, proper eating habit, you can avoid that in the future.
I thank both of you. So in summary, I think we've all realized that I think both the obesity and the psychological well-being is very much interlinked. Dr. Chandrasekhar sir was mentioning about the obesity clinic, which sounds very promising. So we do hope that our patients take advantage of this clinic and get the help and benefit that is needed. Thank you.